My name is Sebastian Debus. I am a professor for surgery and vascular surgery and head of the Department of Vascular Medicine within the University Heart Center at the University Clinics of Hamburg-Eppendorf. Currently, I am president of the German Vascular Society. Within the University Heart Center, we cover about more than 5,000 patients per year. Cios Alpha is a very innovative product with many features which brings us far forward to perform procedures in our vascular field which were not possible in the pre-Cios Alpha era with the conventional C-arms. The quality of imaging is very closely associated with the technical demands of the procedure. The Cios Alpha has large opportunities and large benefits in comparison to standard C-arms. We can see all the structures who are necessary to place the stent in the right position. So there are no wishes left for us in terms of quality. By implementing the flat detector technology within the Cios Alpha, we are able to gain the quality of viewing and acquisition of pictures in the high-end way, because we have the full screen now, we can see, and this is very important, especially in interventions where we need to see the perfusion of end organs like the renals, if we perform a renal artery stenosis. The advantage of technology counts to a wider space between the flat detector and the generator at the bottom. And this makes interventions, manipulations, catheter drawing and manipulating much more easier because you have just more space than in the conventional C-arm. Obesity certainly is a challenge for endovascular procedures. This challenge was mastered in an optimal way by the Cios Alpha because quality of visualization was perfect in this tricky case. The overheating of conventional C-arms was a big problem in former times, especially in procedures which were long-lasting for several hours. We don't have this problem, fortunately, anymore with the Cios Alpha. It is certainly a big development to make the C-arm of the Cios Alpha motorized. And especially if you use the Cios Alpha in combination with a flat table, which you can easily move, then you can cover actually every situation with the C-arm. The problem within the OR often is that we need assistant personnel which is not adequately trained. The people are often changing, and so there is often communications problems with the operating physician and the assisting personnel. One of the major benefits of the C-arm is its easy handling. And secondly, the possibility for the surgeon to actually perform every movement by touching a panel and doing it himself. The possibility of marking certain areas on the screen is a very important tool we use very often, especially in these cases where it is of utmost importance to position the device in just a certain position. For instance, if we perform an endovascular AAA procedure where we position the main body right below the renal arteries, the positioning must fit perfect. Another challenge within endovascular procedures of the aorta is covering the aortic arch. In this situation, the markings are of special benefit because we are able to mark the position of the carotid artery, the left subclavian artery, or even the brachiocephalic trunk, just to be sure that we bring the stent graft into the right position and not to overstent one of these important vessels. I think one of the highest demands for this technology are aortic procedures, advanced aortic procedures. In our experience and in my eyes, I think the Cios Alpha is a perfect tool to do all these procedures.